So OptiCell is the first hematology analyzer on the market that is actually using AI and not physical parameters of the cell. So it's not looking at size or electrical conductance, but actually taking pictures from every possible angle of the cell and then using AI algorithms specific for dogs and cats to analyze the cells and classify them that way. So it's very different. The reason it can do that without a big fluid pack and without a lot of dilution is this unique technology that enables the cells to basically line up one-on-one on somewhat of a conveyor belt within an enclosed cartridge. And then they go past the camera takes pictures, that goes to the AI algorithm. Hundreds of thousands of cells are counted, and that brings us the result. So it's different in that it's cartridge-based. It's very small. It's not a huge machine with a fluid pack, but it's also different that it's AI doing the classification and not just physical parameters of the cells. The time for OptiCell is similar to other analyzers. It's just a few minutes. It's very quick, including a reticulocyte count. Some machines require a second run to do reticulocytes. OptiCell does it every run all the time, so you get the full result of a 5-point differential count and reticulocytes in just a few minutes. The time of the run is actually similar from OptiCell and other machines. What's different is the time that's spent around the blood test. So the maintenance requirements, which are pretty extensive for most traditional hematology analyzers, changing the fluid pack, cleaning the lines, running blanks, that's all part of the normal, pretty extensive maintenance that's required from a hematology analyzer, and none of that is for OptiCell. So a huge time savings in the kind of what it takes around the running the test. And then space, it's tiny. There has never been a hematology analyzer, anything like it. Again, because it doesn't need all these tubes and fluids running through it and dilution of the sample. So it's tiny. It looks like a small chemistry analyzer. The cost is actually really interesting. If you ask a veterinarian in their practice, what is the cost to run a CBC? They actually won't know, because it really depends on how many they run and how much of that fluid pack they utilize. There's a cost in buying the fluid pack every month or however often they do it. There's a cost in the blanks and running those kind of maintenance samples. But the true cost is dependent on how much of that fluid pack do they utilize versus throwing it away, because it does expire and it's relatively short shelf life. So it's variable. Practices run a ton of CBCs, it's less expensive. Practices that don't run as many, it's more expensive per CBC. The beauty of OptiCell is it's just a cartridge, and it's the same cost every time. So you know exactly how much it's going to cost you. You know exactly how much to charge in terms of what kind of margin you want to have in your practice. If you're not running a lot because it's a slow period, it doesn't cost you any more. You're not throwing away anything. If you're running more, you're just using more cartridges. So it's a set cost. It's much easier for the veterinarian to then calculate how much they have to charge and what their revenue is. It's just better for everyone.